Hey guys, Dr. Mike here, Oak Brook Medical Group in Oak Brook, Illinois. Here with the team. We're going to run through some things. So sciatica is a big thing that a lot of people deal with. So we're going to run you through some of the progressions of pelvic tilt exercises that we put our patients through. And again, everything we do with our patients, the whole purpose of it is we're looking at everything. It's going to be a comprehensive approach. So we're looking at the PT, we're looking at stabilizing the core, we're looking at taking pressure off that sciatic nerve. So that most importantly, you guys can feel better quicker, okay? So Genesis is going to start with a standard pelvic tilt here, and she's just going to do a little pump. So when we do pelvic tilt, a couple of things we got to pay attention to. One is you've got that small of the back. You want to think about pushing that into the table as hard as you can, so the pelvis is going to tilt back, hence the name, pelvic tilt, and she's just going to hold that and then relax. And so we start patients out with kind of this pumping pattern. They're going to do 3 sets of 10 of them, and the whole thing is you want to be able to not put anything between the table and the small of your back. That's how you know you're activating appropriately. We don't want to be activating every muscle in the body. It's just focused on the core. So once they've mastered that, now she's going to do a hold. So she's going to go into that pelvic tilt, working on focusing on breathing normal, relaxing every muscle except for that core. The goal is going to be to hold this for 2 minutes straight. Don't hold your breath while you're doing it. Just focus on the core, okay? So good. So once they get that 2 minutes, then we come over here, and Miss Liz is going to show we're going to do pelvic tilt with some kicks. So this is just going to make it a little bit harder. Now, when she's doing these kicks, you see the legs coming out. Again, she's activating that core. Don't let me put that hand underneath it. Ooh, this is a good test. I get to test them now too. So, yep, there you go. So now she's got that core activated. Her low back is flattened into the table, and she's kicking out. This is a nice one too, because you can make this as difficult as you want, right? So Liz's legs are up, she's kind of kicking straight out, and now she took the cue, she's going lower to the table, and that's going to make it harder as we do that. So this is kind of, again, we start with the regular one, start with the hold, then we go into this, and you can even make this one more difficult on your own as well. So next one, coming over here to Mr. Jose. He is going to go through the dead bug version of this. So he's got one of the big physio balls. He's going to rest it on his shin, hold it in his hands. Again, he's activating that core, that pelvic tilt, and now he's not doing it right. He's got this. It tests that coordination. There you go. So now the dead bug version of it. Opposite arm, opposite leg. This is going to be much harder. Whole purpose is, as you bring that arm and leg out, it's going to challenge that core to really stabilize that spine and keep it tight to the table, which is exactly what we want. If you guys can learn how to master this while you're in our office going through treatment, we know your low back's going to be solid. You're going to be feeling good. So if you guys are dealing with sciatica type stuff, or you know anybody that is, call us at that number below. Go to our website, book that first appointment. Let's go through the consultation, see how we can help you, and get you guys feeling better. We'll catch you in the next video.